Hi, my name is Shakira, and today I'll be performing a head to toe assessment. Can you tell me your name and date of birth? So I would check the patient's armband to see if his name and date of birth match. Do you have any history of any surgeries? Do you take any medications? Do you have any allergies? And have you took the influenza shot, which is the flu shot? Now I would assess level of consciousness. Can you tell me where you are? Who's today? What is today? Who's the president? And the timing of the day. Patient is alert and oriented times 4. Mood is pleasant. His posture is up straight. What is your nutritional status diet? Diet is regular. His speech is clear. Language is appropriate. Do you use any mobility aids or a gait belt? Okay, and now I would state the vitals. Um, Blood pressure is 90 over 60 to 120 over 80. Respirations is 12 to 20 breaths per minute, and pulse is 60 to 100 beats per minute. Now I would check clubbing, which means it could be a sign of poor oxygenation. And clubbing is this on the finger. Now I would check cap refill, and that's when I'll press down on the nail bed to see if it blanched in less than 3 seconds. So it blanched in less than 3 seconds. Now I would check radial pulse for 15 seconds. Okay, and then I'll times that by 4. So now I would check general appearance. So I would inspect and palpate the cranium and the hair. So hair is dry. Now I would inspect facial symmetry, and that's to see if the left side of the face and the right side is equal. So both sides are equal. I would inspect for any masses or lesions, and I don't see any. And then I will palpate the frontal sinuses, so the maxillary, which is the cheek, and then the frontal, which is above the eyebrows, and the temporal, which is the side of the head. Okay. And next I believe is the eyes next. So I will ask the patient, do you have any false eyes or any cataracts or any abnormalities? I would check the conjunctiva, the sclera, and the corneas. Inspect, I mean. So The conjunctiva is the bottom of the eye, so I will pull the eyelids down, and both eyelids is pink and moist. The sclera is the eyeball, which is white. And if I was to see yellow, then that's a sign of jaundice. And then the corneas is the pupil. So now I would inspect external structures, which is the outside of the eye. I will do the 6 cardinal gaze. So I will hold my pen light up to the patient's eyes and basically do like a star to see if his eyes follow it. Okay, and then next I would check Perla. Perla means pupils are equal, round, and reacted to light accommodation. So first, I would shine my pen light in the patient's eyes to see if they're both equal. Yes, both are equal. So pupils are equal, round. Next, I would check to see if they both are round. Yes, and they're both round. So next I would check to see if the pupils constrict. So I would shine my pen light in the patient's eye. And they both constrict. And then next I would check light accommodation. So I would have my pen light, I will put my pen light into the patient's face and see if his eyes cross. Okay, so both eyes cross, and that's Perla. So next I believe is the ears. So I would check the external ear, which is the outside of the ear. And then next I would check the internal ear for any blockage or discharge. And I don't see any blockage or discharge. And then I would ask the patient, do you have any hearing concerns, or do you use any hearing aids? So next, face, eyes, ears. Next is the nose. So I would check the nasal septum and patency with my pen light. So I'll shine it in the patient's nose. And then patency, I would have the patient hold one nostril and breathe, and then do the same thing in the opposite nostril. Next, I would inspect for symmetry, so both sides are equal. Inspect for symmetry. I'm having a dull moment. So next I would inspect for symmetry, and then I believe I inspect for any masses or lesions, and I don't see any. I'll come back to the nose. So next I'll inspect the neck. So I would check for any masses or lesions. I would check for symmetry. Both sides are equal. I will inspect JVD, which is that visible vein on the side of the neck, and I see it. Then I will palpate the carotid pulse one side at a time. Then I will palpate the other side. Okay, rhythm is regular. Um, Next is, I believe, the upper extremities. So I will assess range of motion. Excuse me. Um, so I will have the patient, oh yeah, for the last step of the neck, I will have the patient put their head forward, back, to the side, and shrug their shoulders. So now it's upper extremities, so I would assess the patient's strength in their arms, and that basically means I'll have the patient push or pull against my arms to assess their strength, and then I'll assess range of motion in the neck, shoulders, I believe hands and fingers, and then next is the chest. So I would inspect for any masses or lesions, and I don't see any. I would inspect breathing, well, observe breathing. Next, I will auscultate the posterior and lateral breath sounds, which is the back and the side. Using the diaphragm of my stethoscope. And then next, I will auscultate anterior breath sounds, which is the front. And breath sounds are clear. I don't hear any wheezes or crackles or any like friction rub. So next, I will auscultate the heart sounds using the diaphragm of my stethoscope. First sound is aorta, which is the second intercostal space, right intercostal space. And then pulmonic, which is the second left intercostal space. Tricuspid, which is the fourth intercostal space. And mitral, which is the fifth intercostal space, mid-clavicular line. And I hear S1 and S2, which is lub dub, and that's the opening and closing of the heart valves. Okay, so next, the chest. Um, I believe it's the abdomen. So I'm inspecting the patient's skin for any masses, lesions, umbilicus, um, hydration. So skin is warm and dry. Color is normal for anicity. Um, yes, color is normal for anicity. Now I would auscultate bowel sounds using the diaphragm of my stethoscope, and I would start in the right lower quadrant. So bowel sounds are active. They can either be hyperactive, active, or hypoactive. If bowel sounds were absent, I will listen to each quadrant for 5 minutes in a total of 20 minutes. So now I will palpate each quadrant starting at the right lower quadrant. And palpate is a circular motion. And I believe I would ask the patient, do you feel any tenderness and I don't feel any masses? Okay, so then next I would ask the patient, when was your last bowel movement? And I believe that's it for the abdomen. And then last is to inspect lower extremities. So I would inspect for any masses or lesions, and I don't see any. I would inspect for edema, which is swelling, excessive fluid. I don't see any edema. I will palpate the pulsus, which is popliteal, which is behind the knee, posterior tibial, which is the ankle, and dorsalis pedis, which is the front of the foot. Pulse could be anywhere between 0 and 4 plus, with 3 plus being bounding. And I will assess range of motion in the lower extremities. So that would be the hips, the knees, the ankles, and the toes. Then I would inspect the toes. I would inspect and separate the patient's toes. And I believe that's it for lower extremity. So back to nasal. So for nasal, I would inspect septum, the nasal septum, mucosa, and patency. So I will look inside the patient's nose. And patency, I would have the patient hold one nostril and breathe, and then do it on the opposite side. So next, I would check for symmetry. So both sides are equal. And next, I would inspect the mouth. So I would inspect the teeth, the gums, the buccal mucosa, which is the inner cheek, the tongue, and the floor of the mouth. So teeth, gums are white, the buccal mucosa, which is the side of the mouth, the tongue, and the floor of the mouth. Then I would ask the patient, can you smile? Puff out your cheeks and stick out your tongue. And that is my head to toe assessment.